I apologize that I have to keep switching the camera from the computer to myself. So with that said, I do want to touch on one other topic, and that's Typhon. Typhon is a secure site where you will be logging your clinical experience. So for instance, you are at a clinical site and you complete 6 hours and you see 9 patients. So you want to take that HIPAA secure data and enter those into Typhon. I did email everyone out today their particular login, and it'll request you to generate a new password, and that will be your login for Typhon. So for instance, you see Bob Smith, and he is a 40-year-old Hispanic gentleman with hypertension as well as a skin infection. So from the site, you would only bring home that he is BS, 40-year-old male, Hispanic, and the diagnoses that you saw were hypertension and skin infection. So you would then enter that data into Typhon, and the joy of Typhon is this, is that when you are graduating in April of 2018, you can take the information that's entered into Typhon and go to a prospective employer and say, this is a snapshot of my clinical experience. So I saw these 400 or 500 patients, and this is what I saw. I saw 20% hypertension, I saw, and whatever the case may be. So it's very nice for prospective employers to see the variety of patients and age ranges that you saw. And I also want to make you aware of the clinical experiences that you will have in the next year or two, to be aware as you go through clinical sites and as you work as well, to keep in mind prospective clinical preceptors. So you are currently in Adult Health 1 and you will be completing 120 clinical hours. Next term, you'll be starting Adult Health 2. But then based on your specialty in the fall and the spring, you will be either doing pediatrics, women's health, special populations, and the competition in those to get preceptors in those areas can be a bit intense. So if you come upon a person, be it a nurse practitioner or a physician, that you could see giving you a good varied clinical experience, please do reach out to them and ask them if in fact they would precept you during that time. Women's health in particular can be very competitive, only because there's not as many providers and there are a good amount of nurse practitioner students, as you are well aware. So with that said, good luck on your journey with Adult Health 1. I am available. I am now on the 7th floor, and I would just ask you to do this. Those interagency agreements can be scanned to me, and I will send you the scan app that I use. It's wonderful if you have a smartphone, so you don't have to go to a scanning, like a printer or a facility. What you do is you just take a picture of the interagency agreement, you sign it, and then you scan it to me, and it's a lifesaver. I use it all the time, and it makes my life easier. So I hope that you have learned information on Typhon, where to get your information in eCollege, and the only other thing is that if you're at a present site, you will need Epic access as a nurse practitioner student. I have CC'd all of you on an email to Carlos Tollfree, who is our Epic expert.